Today I'm going to be discussing the fetal circulation system. Throughout this PowerPoint, I'm going to be discussing what it is, what components it contains, the flow of the fetal circulation system, and what happens to it after birth. So what is the fetal circulation system? It's a complex system that allows oxygenated blood, deoxygenated blood, nutrients, and waste to be exchanged from the fetus to the placenta. So what is the fetal? So structures that you will see in this circulation system would be the heart, the vessels, the 3 shunts, the umbilical cord, and the placenta. So let's talk about the fetal heart. Fetal heart activity begins at week 6 of gestation. It, like the adult heart, has 4 chambers and 4 valves. The 4 chambers are the right atrium, the right ventricle, the left atrium, and the left ventricle. The 4 valves are the tricuspid valve, which is in between the right atrium and the right ventricle, the pulmonary valve, which is between the right ventricle and the pulmonary artery, the mitral valve, which is between the left atrium and the left ventricle, and the aortic valve, which is between the left ventricle and the aorta. So let's talk. The main vessels that are involved in the fetal circulatory system are the IVC, the aorta, the SVC, the pulmonary artery, the umbilical vein, and the umbilical arteries. So now let's discuss the structures that we refer to as the 3 shunts. The first one is the ductus venosus. This lies between the umbilical vein and the IVC. The second one is ductus arteriosus. This lies between the pulmonary artery and the aortic arch. The third one is the foramen ovale. This lies between the right atrium and the left atrium. The umbilical cord, which is first seen at 8 weeks of gestation, is what connects the fetal side of the placenta to the fetus. It also contains 2 arteries and 1 vein. The placenta, which is first developed in weeks 4 through 5 of gestation, is the main place that nutrients, waste, and blood is exchanged between the fetus and the mother. There are 2 main sides to the placenta. There is the maternal side and the fetal side. Now let's discuss the blood flow path that the fetal circulatory system will take. It is much more complicated than that of the adult circulatory system. This is because the placenta will do all the work that the lungs will do after the baby is born. The path begins at the placenta. Earlier we discussed that the placenta has 2 sides, the maternal side and the fetal side. The maternal side receives nutrient-rich and oxygenated blood from the mother's circulatory system. The fetal side then receives that nutrient-rich and oxygenated blood and passes it through to the umbilical cord. Blood flows from the placenta into the umbilical vein. From the umbilical vein, it goes through the ductus venosus into the IVC. The SVC and the IVC both drain into the right atrium. From the right atrium, most of the blood goes through the foramen ovale into the left atrium. But some blood flows from the right atrium to the right ventricle. From the right ventricle, blood flows from the pulmonary artery through the ductus arteriosus into the aorta. From the left atrium, blood flows to the left ventricle, where it is then distributed out to the aorta. From the aorta, blood is then distributed through the rest of the fetal tissue or to the umbilical arteries. Blood flows. After birth, major changes occur in the fetal circulatory system. Once the umbilical cord is clamped, the baby no longer receives oxygen and nutrients from the mother. This is when the lungs begin to work. Upon that first inspiration of air, the lungs expand and the ductus arteriosus and the foramen ovale begin to close. Other structures that change are the ductus venosus becomes the ligamentum venosum, and the umbilical arteries become the iliac arteries. The umbilical vein then becomes the ligamentum teres. Once this all occurs, this is when the circulatory system and the heart function becomes that of the adult. Thank you for watching. I hope I made it easy for you to understand all the information that is included into the fetal circulatory system.